हेलो, आज हम बात करेंगे एक प्रोसीजर विच इज़ कॉल्ड PCNL। PCNL का मतलब है परक्यूटेनियस नेफ्रोलिथोटमी। सो परक्यूटेनियस नेफ्रोलिथोटमी इज़ ए प्रोसीजर जो कि हम यूज़ करते हैं किडनी से स्टोन को एक्सट्रैक्ट करने के लिए, रिमूव करने के लिए। जो प्रोसीजर है उसको PCNL बोलते हैं। नाउ PCNL इज़ ए टेक्निक जिसके दो तरह के PCNL हैं, prone PCNL, another is a supine PCNL. So when we say prone PCNL or supine PCNL is one and same thing. It depends on the position when we actually do the procedure, how we keep the patient. If we keep the patient on his stomach, we call it a prone, and we keep the patient on his back, we do in the supine position. So that's called the supine position. So PCNL is basically a technique of reaching to the kidney to make a tract by which we extract the stones. Now, in PCNL, while to extract the stones, we use certain energies. Energy can be a laser, it can be a hammer also, which we call as a lithoclast. So these are the two energy sources by which we actually break the stone. And there are certain ultrasonic sources also, energy sources, which we use to break the stone. So these are basically a very small tract made in the kidney from the back and to extract the stones. PCNL is a ideal and gold standard procedure for the larger stones, the stones which is more than 1 centimeter. And agar isse bada stone ho, to ideal treatment is always PCNL. However, nowadays PCNL is combined with the IRS, means retrograde intrarenal surgery, जो कि हम लोग अगर हमारे पास सुपाइन PCNL कर रहे हैं तो वी गेट दिस अपॉर्चुनिटी कि अगर आपका स्टोन किसी ऐसी एंगल में है, ऐसी जगह पे है जहाँ आप एक ट्रैक्ट से, सिंगल ट्रैक्ट से नहीं पहुँच सकते, सो यू गेट ए हेल्प फ्रॉम द RIRS टू गेट द 100% achievement, clearance achievement for the stone removal. Now, since we say PCNL is a gold standard, there is no doubt about that, because this is the only procedure where you can achieve the majority of the clearance of the stones than any other procedure. However, PCNL itself is not very easy to master. It has very high and steep learning curve for the surgeons to master the technique, and for the patients it is definitely a puncture in the back. They will have a little bit of discomfort after the procedure, maybe a few days time. And the most important thing in the PCNL is that when we puncture the kidney is a very vascular organ. So there is around 1% or 1.5% chances that the patient may have some amount of bleeding after the procedure. However, this is never a life-threatening problem. And if, God forbid, there is any issue like that, we do have a very good procedure which is called angioembolization to actually control that bleeding. However, whatever said and done, PCNL is the procedure of choice in any corner of the world to take and extract the stones from the kidney. When the stones are bigger, we can even make at least 2-3 punctures inside the kidney to make the tunnel and go inside the kidney to extract the stones completely. This is the only procedure where we can achieve the stones clearance, the maximum stone clearance from the kidney. I hope that any one of you who is planning to undergo a PCNL will have enough knowledge to select your procedure for your stones. Thank you very much.